Diazepam, commonly known by its brand name Valium, is a widely prescribed medication belonging to the benzodiazepine class. This powerful drug is utilized for various medical purposes, including the treatment of anxiety disorders, muscle spasms, seizures, and alcohol withdrawal symptoms. As with any medication, it's crucial to understand how quickly diazepam takes effect, how long its impact lasts, and what factors can influence its efficacy. Mechanism of action: diazepam exerts its effects by enhancing the activity of gamma-aminobutyric acid, GABA, a neurotransmitter that plays a vital role in regulating brain activity. By amplifying GABA's inhibitory effects, diazepam helps to calm the central nervous system, resulting in reduced anxiety, muscle relaxation, and sedation. Targeting GABA receptors: the medication works by binding to specific GABA receptors in the brain, increasing their sensitivity to the neurotransmitter. This heightened sensitivity leads to decreased neural excitability, reduced transmission of nerve impulses, overall calming effect on the brain and body, impact on neurotransmitter balance by modulating GABA activity. Diazepam influences various neurotransmitter systems, including serotonin, involved in mood regulation and emotional processing; norepinephrine, associated with arousal and stress response; dopamine, linked to reward and motivation. This complex interplay of neurotransmitters contributes to diazepam's diverse therapeutic effects and its potential for both beneficial outcomes and side effects. Onset of action: the time it takes for diazepam to start working can vary depending on several factors, including the route of administration and individual patient characteristics. Understanding these variables is essential for both healthcare providers and patients to manage expectations and optimize treatment outcomes. Oral administration: when taken orally, diazepam typically begins to take effect within 15 to 60 minutes. However, the onset of action can be influenced by stomach contents. Taking diazepam on an empty stomach generally results in faster absorption and quicker onset of effects. Food composition: high-fat meals can delay absorption, potentially extending the time to onset by up to 2.5 hours. Individual metabolism: variations in liver function and metabolic rate can affect how quickly the drug is processed and distributed throughout the body. Other routes of administration: diazepam can also be administered through alternative routes, each with its own onset profile. Intravenous injection: effects can be felt almost immediately, usually within 1-5 minutes. Intramuscular injection: onset typically occurs within 15-30 minutes. Rectal gel: used for seizure management, effects generally begin within 5-15 minutes. Factors affecting onset time: several individual factors can influence how quickly diazepam takes effect. Age: older adults may experience a slower onset due to changes in metabolism and body composition. Liver function: impaired liver function can delay the drug's metabolism, potentially affecting onset time. Body weight: higher body weight may require larger doses for optimal effect, potentially impacting onset time. Tolerance: regular use of benzodiazepines can lead to tolerance, potentially requiring higher doses or longer onset times to achieve the desired effect. Duration of action: while the initial effects of diazepam may be felt relatively quickly, the duration of its action is considerably longer. This extended period of activity is due to the drug's long half-life and the presence of active metabolites. Half-life and active metabolites: diazepam has a half-life ranging from 20 to 80 hours, meaning it takes this long for half of the drug to be eliminated from the body. Additionally, diazepam is metabolized into several active compounds, including nordiazepam, temazepam, oxazepam. These metabolites also have long half-lives, contributing to the prolonged duration of diazepam's effects. Duration of therapeutic effects: the duration of diazepam's therapeutic effects can vary depending on the specific condition being treated. Anxiety relief: effects may last 4-6 hours, although residual anti-anxiety benefits can persist for longer. Muscle relaxation: the muscle relaxing effects typically last 4-6 hours. Seizure control: anticonvulsant effects can last up to 24 hours due to the long half-life and active metabolites. Factors influencing duration: several factors can affect how long diazepam's effects last. Dosage: higher doses generally result in longer-lasting effects. Frequency of use: regular use can lead to accumulation in the body, potentially extending the duration of action. Individual metabolism: Variations in liver function and metabolic rate can influence how long the drug remains active in the body. Age. Older adults may experience prolonged effects due to slower drug metabolism and elimination. Therapeutic uses and effectiveness. Diazepam is prescribed for various medical conditions, with its effectiveness varying depending on the specific indication and individual patient response. Anxiety disorders. For anxiety-related conditions, diazepam typically provides rapid relief of symptoms. Generalized anxiety disorder, GAD, patients often report reduced anxiety within 30-60 minutes of oral administration. Panic disorder. Diazepam can help alleviate acute panic attacks, with effects often noticeable within 15-30 minutes. Social anxiety disorder. The medication may reduce anticipatory anxiety when taken 30-60 minutes before anxiety-provoking social situations. Muscle spasms. Diazepam's muscle relaxant properties make it effective for various muscle-related conditions. Acute back pain. Relief may be experienced within 30-60 minutes of administration. Cerebral palsy. Regular use can help manage muscle spasticity, with effects building up over time. Restless legs syndrome. Some patients report relief within 30-60 minutes of taking the medication. Seizure disorders. As an anticonvulsant, diazepam is particularly useful in managing certain types of seizures. Status epilepticus. Intravenous administration can stop seizures within minutes. Febrile seizures. Rectal gel formulations can provide rapid relief, often within 5-15 minutes. Alcohol withdrawal. Diazepam plays a crucial role in managing alcohol withdrawal symptoms. Acute withdrawal. Effects can be felt within 30-60 minutes of oral administration, helping to reduce anxiety, tremors, and the risk of seizures. Long-term management. The medication's long half-life can provide sustained relief throughout the withdrawal process. Factors affecting effectiveness. The effectiveness of diazepam can be influenced by various factors, which healthcare providers must consider when prescribing and monitoring treatment. Individual patient characteristics. Age. Older adults may be more sensitive to the effects of diazepam and may require lower doses. Body composition. Individuals with higher body fat percentages may experience prolonged effects due to the drug's lipophilic nature. Genetic factors. Variations in genes involved in drug metabolism can affect how individuals respond to diazepam. Concurrent medications. Interactions with other medications can impact diazepam's effectiveness. Opioids can enhance sedative effects, potentially increasing the risk of respiratory depression. Antidepressants. Some antidepressants may alter diazepam metabolism, affecting its effectiveness. Antacids can delay diazepam absorption, potentially affecting onset time. Medical conditions. Certain medical conditions can influence how diazepam works in the body. Liver disease can impair drug metabolism, potentially leading to increased effects or prolonged duration. Respiratory disorders may increase sensitivity to diazepam's respiratory depressant effects. Neurological conditions can alter drug response and effectiveness. Dosage and administration. Proper dosing and administration are crucial for maximizing diazepam's therapeutic benefits while minimizing potential risks. Standard dosing guidelines. Dosage varies depending on the condition being treated. Anxiety disorders, typically 2-10 mg, 2-4 times daily. Muscle spasms, usually 2-10 mg, 3-4 times daily. Seizure disorders. Dosing varies widely based on the specific condition and patient characteristics. Alcohol withdrawal. Initial doses may range from 10-20 mg, with subsequent dosing based on symptom severity. Individualized dosing considerations. Healthcare providers must tailor dosing to each patient's needs, considering age. Lower doses are often recommended for older adults' body weight. Dosage may be adjusted based on body weight, especially in pediatric patients. Liver function. Dose reductions may be necessary for patients with impaired liver function prior benzodiazepine use. Patients with a history of benzodiazepine use may require higher doses due to tolerance. Administration methods. Diazepam can be administered through various routes. Oral tablets. Most common form, typically taken 2-4 times daily. Oral solution. Useful for patients who have difficulty swallowing tablets. Rectal gel. Used for acute seizure management, especially in children. Intravenous injection. Reserved for hospital settings and emergency situations. Side effects and precautions. While diazepam can be highly effective, it's important to be aware of potential side effects and necessary precautions. Common side effects patients may experience. Drowsiness and sedation, dizziness and unsteadiness, confusion or memory problems, muscle weakness, nausea or changes in appetite. Serious side effects. Less common but more severe side effects can include respiratory depression, paradoxical reactions, increased anxiety or agitation, allergic reactions, cognitive impairment, increased risk of falls, especially in older adults. Precautions and contraindications. Diazepam should be used with caution or avoided in certain situations. Pregnancy and breastfeeding can potentially harm the fetus or infant. History of substance abuse, increased risk of dependence and addiction. Severe respiratory disorders may exacerbate breathing difficulties. Myasthenia gravis can worsen muscle weakness. Acute narrow-angle glaucoma may increase intraocular pressure. Long-term use and dependence. While diazepam can be highly effective for short-term use, long-term administration carries risks that must be carefully considered and managed. Tolerance development. With prolonged use, patients may develop tolerance to diazepam's effects. Anxiety relief may diminish over time, requiring dose adjustment. Sedation tolerance to the sedative effects often develops more quickly than to the anxiolytic effects. Anticonvulsant properties generally maintain effectiveness longer than other effects. Physical dependence. Long-term use can lead to physical dependence, characterized by withdrawal symptoms upon discontinuation, need for increasing doses to achieve the same effect, difficulty stopping the medication without medical supervision. Withdrawal symptoms. Abrupt discontinuation of diazepam can result in withdrawal symptoms, including rebound anxiety and insomnia, tremors and muscle spasms, nausea and vomiting, sweating and palpitations. In severe cases, seizures or psychosis. Tapering and discontinuation to minimize withdrawal risks. Discontinuation should be gradual. Slow dose reduction, typically 5–10% every 1–2 weeks. Extended tapering period may take several weeks to months. Symptom monitoring, adjusting the tapering schedule based on individual response. Supportive care, addressing any emerging symptoms during the tapering process. Drug interactions. Diazepam can interact with various substances, potentially altering its effectiveness or increasing the risk of side effects. Alcohol and other CNS depressants. Combining diazepam with alcohol or other central nervous system depressants can lead to enhanced sedation and drowsiness, increased risk of respiratory depression, impaired cognitive function and motor skills, potentially life-threatening overdose. Opioid medications. The combination of diazepam and opioids is particularly dangerous. Synergistic effects on respiratory depression, increased risk of overdose and death, potential for enhanced sedation and cognitive impairment. Other medications. Various drugs can interact with diazepam, including antifungal medications may increase diazepam levels in the body. Certain antibiotics can alter diazepam metabolism. Antidepressants, some may enhance sedative effects or alter drug metabolism. Antacids can affect diazepam absorption. Herbal supplements and natural remedies. Some natural products can interact with diazepam. Street John's wort may decrease diazepam effectiveness. Valerian root can enhance sedative effects. Grapefruit juice may increase diazepam levels in the body. Monitoring and follow-up. Regular monitoring and follow-up are essential for ensuring the safe and effective use of diazepam. Initial assessment. Before starting diazepam treatment, healthcare providers should conduct a thorough medical history, assess for potential contraindications or risk factors, evaluate liver and kidney function, screen for substance use disorders. Ongoing monitoring during treatment. Regular checkups should include assessment of symptom improvement, evaluation of side effects, monitoring for signs of tolerance or dependence, periodic liver function tests, especially with long-term use. Adjusting treatment based on monitoring results. Treatment may need to be adjusted. Dose modifications, increasing or decreasing dosage as needed, changing administration schedule, adjusting timing of doses for optimal effect, considering alternative treatments, exploring non-benzodiazepine options if necessary. Patient education. Ongoing patient education is crucial for safe and effective use. Proper administration techniques, recognizing and reporting side effects, understanding the risks of long-term use and dependence, importance of not abruptly discontinuing the medication. Alternative treatments. While diazepam can be highly effective, it's important to consider alternative treatments, especially for long-term management of anxiety and related conditions. Non-benzodiazepine medications. Several other medication classes can be used to treat anxiety and related disorders. Selective serotonin reuptake inhibitors, SSRIs, often considered first-line treatment for anxiety disorders. Serotonin norepinephrine reuptake inhibitors, SNRIs, can be effective for both anxiety and depression. Buspirone, a non-benzodiazepine anxiolytic with a lower risk of dependence. Beta blockers Can help manage physical symptoms of anxiety. Psychotherapy. Various forms of psychotherapy can be effective for anxiety management. Cognitive behavioral therapy, CBT, helps patients identify and change negative thought patterns. Exposure therapy, particularly useful for specific phobias and social anxiety. Mindfulness-based stress reduction, MBSR, combines meditation and yoga to reduce anxiety and stress. Lifestyle modifications. Certain lifestyle changes can complement or sometimes replace medication. Regular exercise can help reduce anxiety and improve mood. Stress management techniques, such as deep breathing exercises and progressive muscle relaxation. Dietary changes, reducing caffeine and alcohol intake, maintaining a balanced diet. Improving sleep hygiene, establishing regular sleep patterns and creating a conducive sleep environment. Complementary and alternative medicines. Some patients may find relief through alternative approaches. Acupuncture may help reduce anxiety symptoms. Herbal supplements, such as chamomile or passion flower, should be used with caution and under medical supervision. Meditation and yoga can help manage stress and anxiety. Conclusion. Diazepam is a powerful and versatile medication that can provide rapid relief for various conditions, including anxiety disorders, muscle spasms, and seizures. Its onset of action can be relatively quick, often within 15–60 minutes for oral administration, with effects lasting several hours. However, the drug's long half-life and active metabolites can lead to prolonged effects in the body. While diazepam can be highly effective, its use requires careful consideration of individual patient factors, potential side effects, and the risk of dependence with long-term use. Healthcare providers must weigh the benefits against the risks, considering alternative treatments when appropriate. Proper dosing, administration, and ongoing monitoring are crucial for maximizing therapeutic benefits while minimizing potential harm. Patients prescribed diazepam should be well informed about its effects, potential risks, and the importance of following medical advice closely. With proper use and monitoring, diazepam can be a valuable tool in managing various medical conditions, providing relief and improving quality of life for many patients.